An emergency care crisis with a new path forward. Multnomah County and ambulance provider AMR now have a compromise to get more ambulances on the street.
We've reached agreement through mediation to pilot more flexibility in ambulance staffing and improve response times.
The county will allow a hybrid model for ambulance staffing, letting AMR mix paramedics and EMTs to boost the number of ambulances available to respond to 911 calls if AMR meets certain benchmarks. Rob McDonald with AMR says he's relieved and highly confident it will help.
So for us, this is absolutely the right direction. We're excited about it, we're confident about it, but more so, I'm just really happy that the county and us are now together again and working together again.
The county and AMR spent months in formal mediation to reach a deal. KGW investigations have exposed how AMR Multnomah County ambulances frequently arrive late to emergency calls. On nearly 15,000 occasions in 2023, there were 0 AMR ambulances available to respond to life-threatening calls. AMR leaders have called it a crisis, repeatedly asking for this one-in-one staffing model, while county leaders stood by a 2-paramedic requirement, insisting it provided the best medical care. Dr. Richard Bruno, the county's health officer, said city dispatchers are now ready to send different types of ambulances to the different severity of 911 calls.
We've been through all the numbers with AMR. We've gone through all the operations, all the staffing. We spent a lot of time going through that in detail, and so we both feel very confident now that we feel like we've come to an understanding that we can make the system work.
The staffing changes are temporary and will be reviewed over the next year. AMR must staff at least 22 paramedic crews, respond to 85% of non-emergency calls with only EMT crews, and meet other requirements. McDonald says he hopes to see quick improvements to response times, believing this could be the bedrock for EMS in Multnomah County moving forward.
As we can pilot the program, measure its efficacy, and determine what the path forward will be, not just for the year's mediated agreement, but for the next 5 years of EMS.
Today, multiple county commissioners criticized how long it took the county to agree to come to this agreement. And this agreement requires public reporting of response time data, so we will be able to share even more going forward. Last note, this plan still needs board approval, but all signs, including discussion today, point to the board signing off. David?